Very good morning. My name is Nurjahan Faisal. My matrix number 192101472 as candidate A. Today, my group are going to discuss about how healthcare can be improved. And candidate B, Aida 192101404 discuss about hospital building. And candidate C, Atira 192101471 discuss about more doctors. And also Danisha 192101494 will discuss about trained nurses better. I will continue with Aida. What's your opinion, Aida?
Thank you, Jihan. In my opinion, hospital buildings play a significant role in delivering healthcare services, and outcomes include their quality, suitability, cleanliness, patient experience, value for money, and risk mitigation. Air quality is a major factor in the development of healthy buildings to improve healthcare in our country. Poorly ventilated spaces can cause headaches, fatigue, shortness of breath, congestion, and a whole variety of other symptoms. This is crucial since Malaysia is a developing country. There are many constructions that are conducted and had polluted the air. Next, studies have shown that poor environmental quality throughout the hospital buildings can have negative effects on productivity, sometimes to a rate of nearly 10%, as well as increased absences. Thus, all the hospital officers have to ensure that the hospital buildings have a conducive surroundings to enhance the health care of the patients and our country. So, so I want to ask Achira about your opinion, how we can improve our healthcare in Malaysia.
My opinion is more doctors. I think more doctors can be increased healthcare in Malaysia. When we have more doctors in Malaysia, each hospital will have enough doctors and patients will get fast and good treatment. In addition, we can say more time, less patient. Increase in the number of patients compared to the negligible risk in the number of doctors has spelled a very big problem and lower quality of service. This was inevitable since a doctor has to service 5 times the number of patients now compared to a decade back in the same time. So, to solve this problem, the government needs to add more doctors and to treat many patients. And then, better communication skill. This is a very important yet highly underestimated skill. Any communication comprises of two different, speaking and listening. Not only that, if a patient is not able to get his symptom clearly through, or if the doctor is unable to understand the point present by the patient, it becomes practically impossible to provide a cure or solution for the ailment. And thus, the solution should be looked at by both parties. And that's all from me.
I disagree about Akira's point because nowadays, someone who wants to be a doctor is very difficult because the cost of studying to be a doctor is quite expensive with the current unstable economy of the country. So, I want to continue with my point. My point is train nurses better. Nurse must follow clinical guidelines to reduce making mistakes. It is because patient health is more important. So, a nurse have to minimize their mistakes such as medication error. For every drug, a nurse has to follow up a step-by-step process to ensure its safe administration and double-check the medication they want to give to the patient. Besides that, a nurse must honing their clinical skills through hands-on training. This is necessary because nurses are usually not given the opportunity to learn when working. This is especially so when they are asked to work in the emergency or critical care unit, where the work environment is busy. Because nurses spend a lot of time with patients, they affect patient experience of care. When patients have positive experience of nursing care, nurses also experience a good and healthy work environment.
What a good point you have there, Danisha. But I want to add my other point, which is cost of medicine. Cost of the medicine is also important to improve our country's health. By reducing the price of medicine can unfortunately help the unable people to buy the medicine if they are in need without borrowing others' money. Thus, this can improve healthcare in Malaysia, where the number of patients can be reduced. Furthermore, clinics can offer free checkup for patients once a month. This is because nowadays the cost of checkup is added up to the cost of medicine in the clinic. By cutting off the checkup fee once in a blue moon, it automatically can lessen the cost of medicine so that all people can buy medicine in an affordable price. For example, when an unable person got sick and went to the clinic, he can afford to buy medicine and will get healthy in a short period. That's all for me.
I disagree with your point, Aida, because inflation rate will increase and make someone not capable to buy and use the doctor's recommendation medicine. Besides that, in my opinion, education is important to improve our healthcare. Education can gain the knowledge about healthcare. In this case, education of healthcare can discipline ourselves to lead a good method to control our lifestyle. Education can create an opportunity for better health. For example, when somebody eat heavy calories food, they do not think about the side effect of the healthcare. the effect to their healthcare is very dangerous when they always eat heavy calories food without exercising. The junk food also makes someone addicted and make they cannot stop their eating. The disease will face in the future life when they also always eating unhealthy food such as hypertension, diabetes, digestive issues, and stroke. Mostly, the impact of unhealthy food comes almost 30 years old. Eating instant food is good, but need to decrease and control our quantity of food that we eat. Higher education in healthcare also can change our mindset. For example, before this, senior citizens always said bathing at the night is risky because water will enter through the pore easily. But the specialist said the theoretical is the mistake. Fasting at the night giving more benefits in our life, such as help sleep quality while decrease the stress in body system. Besides that, as a natural cleaning from dirty things. Other than that, bath at the night they can decrease this risk of disease. The higher education person can give the details proof about the healthcare. In conclusion, the education need to apply in our subjects in school, such as physical education and health. Tanisha, do you agree about me? What's your opinion with my point, Tanisha?
Yes, I agree because education is very important in our life. Education helps us to acquire new skills and knowledge that will impact our development in life. Mm, I agree with point Jihan, which is education. For example, health. Health professionals have a hard responsibility for the health, well-being, and survival of others. Therefore, health professionals must be highly skilled and connected with others, learn and collect information about the patient, and apply to the patient treatment and care based on medical knowledge.
Also agree with Tanisha and Akira about the education point because education is a must thing that every person should have in their life. So as we all can see that not just not just hospitals, offices, clinics that should take a good care of our healthcare in Malaysia, but all the people are important of taking part in improve our healthcare in Malaysia.
Okay, in conclusion, we okay. In conclusion, we all agree that education is the best way to improve healthcare in Malaysia. Education can create opportunities for better healthcare. Poor health can put educational attainment risk in our life. Okay, that's
That's all. Thank you.